record. So this is chapter 7, musculoskeletal injuries. And this is the sort of thing we're going to be discussing tonight. Here you have different views. Remember, this would be an anterior, this would be a posterior, this would be a lateral view of the human skeleton. And that's what really we're going to talk about, different injuries, different muscles, different bones. So, skeletal system, if you put it all together like that, human skeleton, it's called the skeletal system. And there are 206 bones. You're not tested on that number. And the bones have very specific purpose. So purpose number one will be protection. So if you notice, the heart and lungs are protected by the rib cage. The brain is protected by the skull. These are protective properties of the bones to protect vital organs. The bones give us our shape, and the muscle all gets to sit on top of bone, and we'll talk more about that tonight. So how the muscle interacts with the bones. And the bones are the source of the body to produce red blood cells. So there is a very rich blood content that runs through the bones. And as paramedics, or you may see this, that sometimes medics will drill into a bone in order to reach the blood supply, to give various medications and things, because they work just as well as giving it in a vein, which is our normal method. Okay, this is something you're going to need to know, and you will be tested on from now and forever. All right, so let's make sure we know this. There are in the spine 33 vertebrae. Each one of these bones is considered a vertebra, and altogether they are vertebrae, Lashon Rabin, plural. So the 33 are divided into 5 sections. Now, you need to know the sections in head to toe order, okay? And you need to know how many vertebrae are found in each section. So there are 7 in the cervical section. Cervical section is all the way up here. All right, the highest point, there are 7 vertebrae. 12 in the thoracic section. And if you think about that for a minute, there are 12 ribs, or 12 sets of ribs, 12 on the right, 12 on the left. They all start here in the thoracic section, and they come and wrap around to the front of the body. So that's where your 12 right, 12 left ribs come from. They start as thoracic vertebrae, and they are the thorax, which is the chest. 5 lumbar, there are 5 vertebrae in the lumbar section. Remember, lumbar, lower back. Okay, if you have a fancy car or a fancy chair, you may have lumbar support. That is the lower back. Okay. 5 sacral, which is down here, and 4 coccyx. So there's a lot of discussion whether the 4 is really 1, and it depends who you ask. As far as we're concerned, in emergency medicine, we consider this 5 and 4. Okay. Cervical are known as C, so it would be C1, 2, 3, 4, 5, 6, 7. The thoracic are known as T, so that would be 12, T1 to T12, which would be these. And then lumbar are just called L, L1 to L5. These are not really, we don't really use any method to determine these, but C, T, and L, 7, 12, 5, 5, 4, and 12 pairs of ribs that we spoke about. So the appendicular system is a very old word, and I don't think it's used much in emergency medicine anymore, but it's still something an EMT is expected to know. So the appendicular system will be all the blue bones, blue, green, whatever color that is, okay? Anything that is white over here is in the axillar section here. The axial system will be the cranium, the maxilla, the mandible, and the rib cage. Okay, that'll be the axillar. The appendicular is all the other stuff. And these are all bones that we've spoken about. You have the shoulder girdle made of clavicles and scapulae, which are the collarbone and the shoulder blade, the arms, the humerus, radius ulna, carpals and metacarpals and phalanges. The pelvic girdle, I told you don't have to know the names of all these bones, but you're going to need to know the ischium, and that is the lowest hanging part of the pelvic girdle, which is over here, the ischium. Legs, okay, so you have this long bone, longest bone in the body, strongest, called the femur. The patella is the knee, then tibia, fibula, and then the bones, the calcaneus, which is the heel, and then tarsals, metatarsals, and phalanges. So this is all stuff we've looked at before. Muscle, again, there are 3 distinct types of muscle found in the body, and you need to know what they are and what they do. So muscle, right? Skeletal muscle, that is the muscle of the skeletal system. All right, so skeletal muscle is the muscle that is found anywhere that there's bone. So here it's showing a humerus, and it will be covered with skeletal muscle. Same thing, all over the body is skeletal muscle. And remember, we called this voluntary muscle because you've got to send a message from your brain to make it do something. All right, it's not going to happen by itself. Smooth muscle, this is involuntary. This is stuff like your intestines and all your inner organs are made of smooth muscle. You do not control them actively. You don't have to think to digest your food, to put the sugars here and the fats there and bring these amino acids and then break down and whatever. You're not thinking about that. That's why it's called involuntary. Smooth muscle. The most special muscle, of course, is cardiac muscle, and that is the myocardium. And this is only found in the heart. So 3 types of muscle, know where they are and what they do. All right, new words. Cartilage, ligament, and tendon. Let's look at these words. So cartilage is the least important. It's just a cushioning between bones. So it would be in here. And it prevents the bones from rubbing against each other and wearing down. Not something that you'll really be talking about. Ligaments and tendons, okay? So ligaments are bone to bone. If we want to connect this bone to this bone, or this one to this one, as you see this pinky purple color, these are all ligaments, all right? And the last one is called a tendon. A tendon is at the end and the beginning of every muscle, and a tendon is what actually connects the muscle to the bone. So it's like muscle, has the same properties as muscle. It's just that the tendon actually is the connection from muscle to bone. So these are things that you're going to remember. I made this this acronym EMTB, which is what you're becoming, and it stands for every muscle, tendon, bone. So it's just a way to remember what the tendon does. We'll talk about it soon. Injuries. So just to clear any sort of what are they called? Myth. Okay, a fracture is a break, and a break is a fracture. They are the same thing. They are the same thing. So if I ask you, is this a break or a fracture? It doesn't matter which one you would answer, you would be correct. All right, this is obviously a very severe break, and they don't always look this bad, but I wanted to show something dramatic for the introduction. So this is a fracture, and we'll talk about what we need to know. All right, this is more just for your general knowledge. You do not need to learn these, and you will not be tested on these. But these are, I don't know, what we got here, 6, 7 different fractures. This is very common with children, by the way, green stick fractures. So there's just a crack along one of the edges of the bone. It's still a fracture or a break. And children get this more than anybody else. Here you would see a linear fracture where there's not even any separation. Okay, so different types. I just mentioned the green stick because children, you will see this a lot in children. All right, what do you need to know? Well, you need to know these words and definitions. So an open or a compound fracture, they mean the same thing, is where you see bone protruding through the skin. So it doesn't mean that they're bleeding. It means that you see bone. So very often you'll have somebody that looks like they have a fracture and they also have lacerations, or let's just call them soft tissue injuries. That doesn't make an open fracture. It could be an open wound, but not an open fracture. So again, in order to be an open fracture, we call it a compound fracture. I put in parentheses, being used less. You'll notice that medicine they're trying to get things, make things easier in certain ways, dumbing it down, but the real name is a compound fracture, and it means that you see the bone. Now, maybe more significant or maybe more life-threatening can often be a closed, also known as a simple fracture, because you have no idea what's going on inside. So if you look at this picture, is it possible that a vein, an artery, or even a nerve has been cut, dissected, crushed? So we often don't know the extent of the injury. with fractures, and they should always be taken very seriously. And we're going to talk more about recognition and what we need to do. All right, a dislocation. Dislocation only happens at a joint, right? So this is an elbow dislocation, okay? And a dislocation means the movement of a joint beyond its normal range. So it's been moved more than it should have been. It's in the wrong place. That's the definition of a dislocation. Okay, I don't want to get into this tonight. An EMT in New York State is allowed to reduce a patella dislocation. EMTs in New York State are allowed. In New York City, they're not. And there's a lot of rules here. I'm not going to get into it. I've never seen anything on an exam about it yet. So it can only be medial or lateral. It cannot be that it's proximal or distal. So this is something maybe we can discuss on a skill night, but very, I just added it because New York State wanted it discussed. So it has to be a medial or lateral patella dislocation. All right, this is something you will be tested on, these two words. These are two words that are used in America. Nobody understands or knows what they mean. And people use them and they have no clue. So let's start with a strain. Strain. S-T-T. Strain reminds you of T for tendon. Tendon is a muscle. So you can only strain a muscle or a tendon. It's that simple. So a hamstring injury would be a strain, okay? Because hamstring is a muscle, and a muscle gets overused, such as in sports events, can lead to a strained muscle. So remember that. The other one is a sprain, and you can only sprain a ligament. So you cannot sprain your bones, and you cannot sprain a muscle. You can only sprain a ligament. So the most famous ligament is probably the ACL. You hear about that a lot in different sports injuries, the ACL. The L.
When you say sprained ankle, what does that mean?
I have no idea. Who says that?
Everybody says they have a sprained ankle. So
Yeah, so I told you, nobody knows how.
Right. So that means a fractured ankle?
I don't know. They would have to see, what a doctor says. All right. So I don't know.
There's no such thing as a sprained ankle.
There is a sprain ATL, which is one of the ligaments in the ankle. There are a few ligaments at the ankle, and any of them could be sprained, but it has to be a ligament.
Right, so it's not a sprained ankle, it's a sprained ligament.
Right. Okay. So there are different types of sprains from, a grade 1 to a grade 3. You won't be tested on that. Just know, here, I think I have the next slide. Here you go. You need to know this entire chart. I put it all together in a chart. So if I say, what can be fractured or broken? You could say a bone, only a bone, all right? What happens to joints, they could be dislocated. Tendons and muscles can be strained, ligaments can be sprained. And I've seen New York State ask 4 of these questions. 4. There's only 4 possible. Okay, so I would know this. So basically, the question is, you come to little Bobby and he's laying there on the baseball field and he can't move and he can't walk and he's in pain and he's crying and whatever. What's wrong with little Bobby? And you don't know, right? You're not supposed to know. Why? Because we do not have x-rays. Okay? We don't have x-ray capability. In order to diagnose a fracture, you need an x-ray. Just interesting to note that an x-ray cannot see muscle and cannot see ligament. Okay? So you cannot rule out sprains and strains because of an x-ray. You can only rule out bone situation or joints, because joints are made of bones. So x-ray is used primarily to look at bones. It's also used to look at the chest, because there are a lot of bones and we can see how the air should look. Air should look black on x-ray. Okay, so if we see something other than air in the lungs, then we know that's bad. But other than lungs, we don't really use x-ray for anything much other than bones. So we don't have x-rays in the back of the ambulances. They haven't made them cheap enough, small enough, portable. We don't have it. And you've seen x-ray machines, right, in the hospitals or whatever. Urgent cares. I mean, they're huge, huge machines. And they use, obviously, x-rays, which is like a type of radiation. And we don't have that. So what do we do when we're stuck now with little Johnny? All right, and his leg, his foot, I don't know, something's really bothering him. So what it says here is we treat everything as if it's the worst. And the worst of these 4 is always going to be a fracture. The state cannot use the word fracture because a fracture or a break is a diagnosis. It's an absolute. And you cannot make a diagnosis of a break or a fracture because you don't have x-ray capability. The state uses politically correct wording, and it calls it a painful, swollen, or deformed extremity. Swollen just means that looks like there's a grapefruit, you know, coming out of one of the bones. I mean, it looks huge. Okay, that's swollen. Deformed means that his right one don't look the same as his left one. And you compare the 2 on the same patient, obviously not compared to yours. We always assume that it's fractured. All right, let's go through some of the signs and symptoms, some of the things that we can see. Some of these I'm going to do on another slide. Some of these I'm going to ignore. Some of these I'm going to speak about. So bruising can be a sign. Crepitus is where you hear bone rubbing against bone. Deformity and angulation. So this guy may be angulated if he cannot return his arm to normal. All right. Is he deformed? I don't know. Look at his right arm, look at his left arm. They look more or less the same. Then he's not, that's not deformity. But angulated, you have to know if he can put that down normally or not. Exposed bone ends, you can see that if the bone sticks all the way through. False motion is either they think they're moving and they're not, or they think that they're not moving and they are. So it's not very common. I'm gonna miss the next three. Swelling obviously is a ball that's like grown out of and tenderness. Let's get this word. Okay, pain is when you walk up and they're screaming and crying and shouting. That's pain. But what's tenderness? Tenderness is when you palpate, that's a big medical word, touch, part of their body. So if they scream or cry or even scrub their face, when you palpate, when you touch them, that's called tenderness. If they're completely still and fine before you get there, then they're not in pain. Pain is that they're exhibiting signs of pain. Tenderness is you caused it. Well, you didn't cause it, but you brought it on by touching them. All right, three very important letters that we're going to refer to over and over and over. We call it PMS, and it stands for pulse, motor, and sensory. All right. Again, these are things that we're going to do at a skill night. Pulse is check a distal pulse to the injury. So if the injury was by, let's say, the elbow, the radius ulnar is distal to the injury. We don't care about proximal. We want to make sure that there is a pulse felt distal to the injury. Motor is very easy. You ask them to wiggle their fingers or toes. Ask them to wiggle their fingers or toes. So this guy has 3 fingers and a thumb, maybe. So he's wiggling them. Okay. And same thing, if the injury would be in the leg, then you would get him to move distal to the injury. Sensory is a very simple test, but it can tell you a lot. We'll show you how to do it, but basically you're going to lightly touch one of their fingers, usually the thumb or the pinky, and you don't let them see which finger you're tapping, and you ask them if they felt anything and which finger was it. And this is a check for nerve damage, for neurological injury. So pulse, this is a check for cardiovascular. Okay, motor and sensory are checking for a neurological injury. So but you need to do all these 3 on every patient, PMS. So we're going to use splints. These are called rigid splints. This is what we carry in the ambulances. This a lot of people carry in their own personal equipment. Same idea, same concept. The main reason for splinting is to decrease pain. It really works. After that, we don't want any further damage to tissues, blood vessels, nerves, right? So it's very important. It's very important to splint correctly, and we will show you how to do that. Many different types of splints. In class, we're going to focus on the rigid splints. We're going to use a lot of them. We're going to teach you how to use the traction splint. Anatomic is more for wilderness first aid, or if you're stuck and you don't have any real equipment, you can do an anatomic splint where you're actually splinting the extremity to the person itself. So like that. Soft splints, we use actually pillows as a soft splint for the ankle. So we'll show you that. All right, these two pictures were made by a student of mine. And I think I thank him every time I get to them. So if we need to immobilize a bone, so let's take a look at the picture, and we see there's a huge swelling, probably pain, maybe tenderness, and that is at the radius ulnar bone. We always refer to the radius ulnar as one. Reason, because they run right next to each other and we can't see and we don't have an x-ray. So we refer to it as the radius ulnar. Same thing we do in the lower leg, we call it the tib fib injury, because there's the tibia and the fibula. Again, in the field, we don't know which one is necessarily injured. If they are protruding, even if one of them is protruding, then yeah, you could then say, okay, this is the radius. How do I know? Because it's running along the lateral side, okay? So I know it's the radius, but other than that, there's no way to know. So this patient has a radius ulnar injury. And look at what are our instructions for a possible fractured bone or bone injury. Number one, BSI, always BSI, right? Scene safety, put on gloves. Number two, PMS. So remember, we're only going to check for PMS in that extremity, okay? Not in all four, just in that extremity. That's where the injury is. It's isolated. Number three, look how we splint. We're going to splint the area that may be fractured. But look, now we've got to splint the joint proximal and distal to the area. So the proximal joint to that injury is the elbow. The distal joint is the wrist, which means that the wrist, the elbow, and the radius ulnar all have to be splinted and immobilized. And we're going to teach you. Number four, we always do PMS after we apply any type of splint. So it's PMS before, PMS after. And five would be transport. So this is how we immobilize a bone. Why do we think it's a bone injury? Because look where it is. Look where the swelling is. Look where the pain is or the tenderness, right? All right, now we have a joint injury. Where's the injury? Well, it's at the elbow. Is the elbow a joint? Absolutely, yes, it is. So wrist is a joint, shoulder is a joint, all right? Elbow is a joint. So what do we do? Number one, BSI and scene safety. Always, first, always. Number two, check PMS, again, in this hand, okay? Everything needs to be distal to the injury. Number three, now we're going to splint. Okay, what are we going to splint? We're going to splint the area of the injury, okay? The bone, proximal and distal. Okay, so what is my proximal bone to the elbow? Well, it's right here.
Humerus.
Humerus, right? And my distal bones are going to be the radius ulnar. So that's what would have to be splinted. We will then recheck our pulse motor sensory. We will transport. So again, it's always twice, before and after every splint. General rules of splinting, I've done most of it, but I just want to talk about here. If severely deformed long bone, or if circulation is impaired. What does that mean? That means that you cannot feel a distal pulse. It's so bad. It's so messed up, if you like. It's so deformed that there's no pulse when you did your PMS check. That's bad. All right. What do? You're allowed to pull with gentle traction before splinting. You get one shot. So you will actually pull. Traction means to pull on the arm, leg, whatever it is. Try to get a pulse back. You may do it just by giving it a pull and putting it in the right direction, the way the arm or leg was supposed to be.
The patient in that case could be conscious still, right?
Yeah, it would be.
Right.